Hey everyone, it's Jess. I am coming to you with a solo episode today. Unfortunately, Jill couldn't make it, but to follow up on our conversation that we had a few weeks ago about pregnancy myths, I'm going to talk about postpartum myths because that's kind of my wheelhouse in my professional life as well as my personal life. And while we can't really say that anecdotal evidence is evidence, it still counts for something. So let's get into it. Win for the week. Do I have a win? I feel like things are just kind of going with the flow. Nothing feels incredibly hard at the moment. So that feels kind of good. Leaning into possibilities for new things. Hopefully I'll have more to share soon. Anyways, everything's just feeling kind of good, effortless. So here we go. Postpartum myths. And before I start, if you have any that you want us to talk about or debunk, we would be more than happy to do that. So we're going to jump in really, really deep right off the bat. And the first one is that you will automatically lose weight if you breastfeed. This is problematic for a lot of reasons. First of all, it's not necessarily true. Some people do, and some people don't. And I usually feel like it ends up being the people who really believe this that end up not. And then they get really angry about it. The truth is you need to support your breastfeeding journey with extra calories. And I think the only thing you're going to run into is if you start to restrict, you're going to mess up your supply, which in turn is going to be detrimental to your child, which sounds kind of harsh, but it's true. You do need to support the supply. You need to be hydrated. You need to have protein. You need to have carbs. You need to have fats. I know there's a lot of things that people say are like, oh, like these lactation cookies or whatever. The truth is if you eat a really nutrient dense diet, you're probably going to be okay. One that has lots of vitamins, lots of minerals. Staying hydrated is really important here. And just not thinking about those body changes as you're trying to build your supply. I know it's really easy to feel like I'm not pregnant anymore. I can get back to me. But if you're a breastfeeding parent, your body is no longer your own for however long you decide. So we do need to think about what the priorities really are. And yes, it is important to take care of yourself. It's also important to be able to take care of that little human, because if you are their main source of nutrition, it's on you, right? So let's not be thinking about those body changes in this time. Okay. Next one. Your 6-week checkup is a green light. I know a lot of doctors, OBs will say, just go back to doing what you were doing. People who were actively strength training before they gave birth, people who were very, very active, even if you were just sort of doing like a mediocre bit of lifting, that's not for you. Okay. The best way to describe it is you need to rebuild as if you've spent however many weeks away from being injured. You had a major life event, whether you had a C-section delivery or a vaginal delivery, or you attempted a vaginal delivery and you had a significant amount of pushing, perhaps even some stuff happening where you were almost delivering and then not, and then went for a C-section. You could be healing from both types of birth. So basically your 6-week checkup is to make sure that your tissues are healing or healed. Now, It's impossible for me to say if they are healed or not. Everybody's different, but what we know from general tissue healing guidelines is that 6 weeks internally, you should be relatively healed. And we're talking about that. The placenta, where it detaches from your uterus, is pretty much healed. And the risk of infection is significantly lower than it was in the previous 6 weeks. That's what we're talking about when we're talking about your 6-week checkup. And I know a lot of people will say, oh, the only thing my OB did was take a look and then ask me if I wanted birth control. That's their job. Their job is to make sure the internal tissue is doing what it's supposed to be doing. Their job is to make sure if you had any external tearing, that things are looking the way they should. Their job is to make sure that if you had a C-section, that your scar looks relatively like it's on its way, healing, not infected, and to make sure that at this point, if you are going to be having intercourse, it is now safe again because your risk of infection is low, like I said. But if you are going to, then we need to make sure that your body is healed enough, because at this point and any point afterwards, you could get pregnant again, whether you're breastfeeding or not. That's important to know. Breastfeeding is not birth control, friends. Whether you have your period or not, you might be ovulating. There's no way for us to know unless, maybe you're tracking temperature and things like that, but even still, you could ovulate before your period comes, and then you could find yourself with 2 humans under the age of like 13, 14 months, maybe. And if that's not your plan, just know that it's a possibility. So that's why they ask you about birth control. They want to make sure that your body is prepared for the next, healed enough and prepared if you choose to go through a pregnancy and deliver again. So what should you do after that point? Well, I would probably book in with a pelvic floor physio within a week after you gave birth, if it's something that you're thinking about. As soon as you think you might be wanting to move your body again in a purposeful way, book in with that pelvic floor PT. You can go see them as early as 4 weeks. I would probably say most people, even if you're still bleeding a little bit, you can definitely go see them and get started on some core connection and making sure that you are working your way back to the fitness level that you want to be. Your pelvic floor physio is the expert in musculoskeletal. Your pelvic floor is a muscle. So that's why I say talk to them, not necessarily your OB, because they're the experts. They'll give you a plan. If you're planning on returning to a sport or running, I would go see a pelvic floor PT who specializes in that kind of thing. My pelvic floor physio after birth is a runner. So that was really helpful to have her on my side and tell me what I can expect, and how to go about rebuilding, because I wasn't a postpartum run coach when I was newly postpartum. So a little bit less of a technical myth. The next one is your body is ruined, and that's not true. Your body might be different. Your body is different. Things have changed. We know that your rib cage tends to expand for childbirth. It may or may not go back. Your feet may change when you're pregnant. They may or may not. They might be bigger. Your hips can definitely change. Even just the shape of your body can change. So yeah, it might be different, and that can be hard to take because that's not what you're used to. Maybe you've been in this body for like 30 some years and you're like, I just got used to the way things are, and now they're different. Your breasts will be different, whether you breastfeed or not. So maybe none of your bras fit, maybe none of your tops fit, maybe you wore all your favorite leggings during pregnancy and they were fine and now they're not. Nothing is ruined. And honestly, even if you had some trauma, some physical trauma or some tearing, diastasis, C-section, your body is not ruined. You're never too far gone. And there are people who specialize in helping you get to where you want or need to be. So try not to think like that. Try to use things like, I read a really good quote of using and instead of but. So like, I want to get back to running, but my body is ruined. You can say, I want to get back to running and I have a long way to go. Right? It kind of changes that narrative. It puts a little bit more of a positive spin on it. Not to be toxically positive, but and it changes the way your brain thinks about it. Something that was told to me a couple times, and I know I've mentioned it, is you'll never leave your house again. Maybe not right now. It is like -40 outside, but you will leave your house again. And I promise you, every time you do, it gets easier. You'll get into a routine. You'll figure out what you like to bring in your diaper bag, what you don't need to bring in your diaper bag. You will feel confident in taking your child places the more you go. And I know when my daughter was little, it was like the winter of 2021. So we were, pretty much still in the COVID time. So taking her places was stressful. We were like, is she going to get sick? What's going to happen? But it does get easier. It will get warmer. You'll be able to go out and do things. And you know what? It's still hard. It's still hard because you just never know how your child is going to react. They're going to have a spit up or blowout or a tantrum or anything like that. But getting out of the house is worth it when it is safe to do so. One thing that I've seen a little bit of lately, not too much because I tend not to follow people who make absolute claims, is don't run for 6 months to a year. I think that is a little long. Typically, most people between 12 and 16 weeks will be okay with starting a return to run program. I probably wouldn't start before that unless, here's the stipulations of which I would say it's okay. You had a very uncomplicated pregnancy and birth. You didn't have any tearing. You've been to pelvic floor physio and they've said that healing is happened, you're fine, you don't have any symptoms, and it will benefit your mental health. And you have a history of being a runner or you're a professional runner. That changes things a little bit when you are your lifetime miles. I've said this a ton of times before, your lifetime miles do absolutely matter. But anything, if you're a regular person like me, full disclosure, I know I've said this before, but I waited until 16 weeks to even try anything. I just didn't feel ready. And I think you will truly know in your heart of hearts if you are ready or not. There is a return to run screen that has been out for a couple of years now from a university in the UK. And it is a really great screen to test if you are even ready to think about running. If you would like more information, just contact me directly and I can send you what you need. But it's always good to kind of see where you're at before you're just like, I'm just going to head out the door, go for a jog. We should be doing movement prep. We should be doing this just like we would if you were injured. You wouldn't just say, oh, my ankle sprain is healed, it's time to go. You would have been doing exercises to make sure that everything's good to go before that point, right? So there's going to be a little bit in between. Now I know we know information about tissue healing as far as like C-section scars and the tensile strength of your tissue. Again, that isn't up to me to decide. So, and I do think that 6 months is a very long time for a runner to wait. And I feel like that little piece of mental health, and maybe it's a big piece of mental health or even your identity as a person. I think that's an important factor. So I wouldn't ever give you a hard line on yes or no. I would say, this is what we know with that information, and you get to make your decision. That's always going to be my stance. Speaking in absolutes just gives me the ick. Okay. You need to be fully rested before you do a workout. If you are listening as a parent, you will know if we waited to be fully rested, we would never exercise. So what I will tell you is that you need to use your best judgment. As with all of this, you need to use your best judgment, right? If you follow, like if you use a watch to follow like your HRV or your resting heart rate, that can be really helpful in seeing if you are sort of getting into that low category. If your resting heart rate spikes, maybe you need a rest day. But use your best judgment and say, will I feel better after I do this? Or is this going to dig me deeper into a hole? Be honest with yourself. Make sure you're getting plenty of fuel, plenty of fluids, and do what you need to do. Maybe you were supposed to go for a long run, but you're feeling kind of gassed, so you go for 20 minutes. Maybe you were supposed to do squat day, relatively heavy lifting, and you do some yoga instead. There's always an alternative, and it's never going to be the wrong choice. Okay. Here's a very specific one. Don't do sit-ups or abdominal flexion or anything like that if you have a diastasis. Absolutely not true. And what I will say from a diastasis standpoint is that there was a time when we really cared about what it looked like, how many fingers of separation you had, all those kinds of things. And I know aesthetics are important to a lot of people, but I would invite you to think a little deeper, pun absolutely intended, in that we really care more about what your abdominal muscles can do outside of what it looks like. So are you getting good muscle contraction? Are you able to do the movements that you need? Are you able to twist under control? Are you able to do some flexion with control? Are you able to hold a static position like a plank or a side plank? And when you do those things, what's happening? Are you getting back pain? Are you getting hip pain? Are you getting a pelvic floor symptom? Like, are you leaking? Are you bearing down? Are you holding your breath? I want to know what it looks like when you do those things and what it feels like. And if you feel like you're getting a good core contraction, then you can absolutely do the sit-ups, the toes to bar, the things that you want to be doing. Because if we told everybody who had diastasis that they couldn't do sit-ups or any sort of abdominal flexion, people would be log rolling out of bed. Nobody would be able to go back to a CrossFit gym or anything like that. And some people, all that aside, let's just go to the fact that some people might actually like doing sit-ups, myself included. I love doing sit-ups. I had a diastasis during my pregnancy. Everybody does. It's not something you can avoid. And I still have a little bit of a separation around my belly button. And you know what? It's 2 years postpartum. I don't know that it's going to close up. But you know what? The thing is I have a pretty strong core. I can do a lot of things. I don't have back pain. I don't have hip pain most of the time. I don't have symptoms most of the time, especially not when I'm doing core exercises. So is it a problem? No, not for me. So I can see where you might think it's a problem for you because you don't like the way that it looks. You don't like that you can shove a couple fingers in there. That's fine. That's not something I can fix. Okay. We can do all the abdominal work you want, but if you are somebody who just had a really big baby, or if you had a really big belly when you were pregnant, or maybe you had multiples, maybe you've had multiple children, there are things that have changed that I cannot fix. I know quite a few people who have had surgical fixes, and then we can start to rebuild from there. But again, like the rehab is going to be similar to building from a C-section, right? Something has changed in your abdominal wall, and we need to rebuild just like any other injury. So can you do core exercises if you have diastasis? Yes. Are there any to avoid? Only the ones you don't like. Next one, you need to be symptom-free before you exercise. Nope. That's not up for me to decide either. So I will always ask you what kind of symptoms you have, if you're having any, and when they happen, where they happen, and how you feel about it. I used to be in the camp, and I will admit this fully. I used to be in the camp where I would say, like, if you leak when you're lifting, like, you shouldn't. You should stop. If you leak when you run, you shouldn't run. My position has changed significantly because it's really none of my business whether you are okay with it. And if you're not okay with it, I'd love to help you. But if you are okay with it, I will be here when you're ready to change. But I can't make you want to change. And that's totally fine. If you leak a little and you're like, you know what, when I do a long run and I pick up the pace right at the end to a certain pace, and I'm feeling tired, my pelvic floor is tired, I get a little bit of leaking. But I'm okay with that. I would say, okay, that's fine. And then I would follow it up with, if you ever want to change that, we can talk about it. But if you're okay with it, honestly, I'm okay with it. And here's why. And I said this earlier in this podcast, the mental health aspect of doing the exercise versus having the symptoms, you're not going to ruin anything. Your uterus is not going to fall out. It might not get any better if you just keep going and ignore it, but the chances of it getting significantly worse, neither here nor there, really. They might not, right? We don't know. If you're okay with only wearing black leggings because you leak a little, that's okay by me. So and this is really what you have to ask yourself is, does the benefits of this movement and having this symptom come up outweigh me backing off of this movement and, taking care of the issue? And again, I don't really know the answer to that. If it happens like one time and you're like, yeah, I was just probably tired. Yeah, usually it's a quick fix. Honestly, I have people say that all the time. They're like, yeah, like this deadlifts I was doing, like the last 4 reps, I was like struggling to like not pee my pants. And I'm like, okay, well, did you have to pee before you started the set? Like, that's a valid question, right? Or try this breathing technique or whatever. But yeah, you absolutely don't have to be symptom-free before you start movement. Last couple here. Your workouts will look the same as they did before. Well, I can tell you right now, mine sure don't. I used to be able to go to the gym whenever I wanted for an hour, 90 minutes at a time, not really think about that. Your workouts might require a lot more planning when you have a small child. Your workouts might be a little bit shorter. Your workouts might be a lot shorter. You might not have the energy. You might be doing home workouts instead of going to the gym because your gym doesn't allow kids and they don't have child minding, or the child minding hours don't jive with nap time, or, for whatever reason it is, your workouts might look different, and that's okay. The problem tends to come up when you don't want them to look any different, or you're not willing to see what they could look like. So, being very rigid as a new parent, probably not the vibe. Being flexible and knowing that 20-minute workouts, they still count. A 5-minute yoga session still counts. A 15-minute run definitely counts. The start of a workout and then you got interrupted by nap time still counts. Everything you do counts. it can be really easy to get down on yourself, but I think the best thing you can do is aim for consistency. Move your body on purpose with some intention every day, whether that looks like a walk, yoga, stretching, a short jog, a long jog, a weight session, whatever it is. Purposeful movement consistently will always trump long bouts of all or nothing. You go all in for a couple weeks, go nothing for a couple weeks. I would rather you do a few days in a row of 10-minute workouts than nothing at all. And then all again, nothing at all. And then we can build on what's feeling good and what's working. And that is kind of postpartum in a nutshell. Build on what's feeling good and what's working for you. So that's the end of my list. I know this is going to be a much shorter podcast than you're used to, but you know what, you guys, it's really hard to just sit here and talk to yourself. So I'm going to put it out there. If you have any postpartum myths, postpartum questions, comment them either through Spotify. You can do it directly on the episode. You can go to YouTube and leave a comment. You can leave a comment on our Instagram. You can send me a DM at JLifeFitness. Our podcast Instagram is at Lattes and Lifting Podcast. Leave us a question, leave us a comment, and let us know any postpartum myths or questions that have come up for you. Bonus points if they are related to exercise and nutrition. But if you've got any parenting questions, I will do my absolute best to answer them for you and let you know either what worked for me or information that you can find it. So that's going to wrap it up for me today. Thanks for listening. As always, hopefully we'll be back together next week. And stay warm if you are in the YEG area.